Hey everybody, April here. And I want to talk about how to talk to your family member about cannabis. I shared this information with a group last week and I wanted to get it online because I do think it's really important information. Now, this group were, the majority of them were cannabis users and were trying to figure out ways to help their family members with cannabis. And I was thinking about it, and really honestly, this information could be beneficial to anyone if someone is just getting started or really just considering it, and they are trying to discuss that with their significant other, their family, their friends. It's a tough conversation. So I'm going to share some tips on that. The number one thing is, don't get frustrated with someone. We all were raised in different homes and have different experiences, and we feel differently about things. And what I believe and what someone else may believe, it's not going to be the same thing. And I don't uh, want them to be frustrated. I don't want to be frustrated if we're not on the same page about something. So just understand it takes some people more time than others. And then, of course, there are some people that are just never going to get there and want to do what they're comfortable with. Um, you know, Patients are used to going to the doctor and getting a prescription and going to the pharmacy and picking it up. Using cannabis for medical reasons is a totally new ball game for them, and it's difficult to make that transition. There are so many of the stereotypes and the stigma that cannabis comes along with. So don't get frustrated and address the stigma and address those stereotypes. Ask the person what their hesitation is or what their concerns are. I've had patients tell me that they're concerned it's going to cause brain damage. Well, I have the research that I can show them, and actually, cannabis does not cause brain damage. That cannabis is actually neuroprotective and can protect against those neurodegenerative conditions like MS, Parkinson's, Alzheimer's, dementia, Huntington's disease. There is no evidence out there that says cannabis causes brain damage. Now, in some populations, like for adolescents, for example, and pediatrics, if they need THC for medical reasons, most of the physicians out there practicing cannabis medicine will say that they need to take that in conjunction with CBD. But that's one particular population. But in general, from the research, we have that cannabis just doesn't cause brain damage and doesn't make you lazy. That's another one that I frequently hear. All right, so there's, of course, all people everywhere have heard of CBD, and a lot of people are taking it. I mean, everyone has a neighbor, a friend who's taking CBD and is, getting a lot of benefit from it, right? So again, when you're having that conversation, maybe ask them if they've heard of CBD, if they know anyone who's taking it. CBD is just one of those compounds of the cannabis plant, and if they have a friend who's finding benefit from that one compound, there's why couldn't they get benefit from the THC? Talk to them about the endocannabinoid system and how it works, and why someone does experience certain benefits with CBD, and know the difference between the different benefits of CBD and THC, and maybe do some research on what conditions those are good for, and talk about the entourage effect. So the entourage effect is when you take the whole plant with the CBD, the THC, the CBN, the CBG, all those cannabinoids, all those terpenes, those compounds that give it the smell and the taste. And they all work together to provide the most medical benefit. So definitely you'll want to have a little bit of background knowledge on the endocannabinoid system before you have that conversation. Another really important thing when you're talking to family members who have questions or are considering it is tell them that there are other ways to consume cannabis besides smoking. Um, Smoking cannabis is the most popular method. It's the easiest. I mean, you buy the flower, you light it on fire somehow, right? And you get the pretty much the immediate effects. But there's I mean, patches, lotions, oils, edibles, tinctures. I mean, there's so many things, and you just don't have to smoke it anymore. There's lots of different ways to consume cannabis these days. The other thing that's really important is to tell them that they don't necessarily have to feel the psychoactive effects. One of the big things I push is, patients have the ability to heal without getting high. It absolutely is possible. You don't have to feel high to get the medical benefits of the compounds in the cannabis plant. So that's important for people to understand, because a lot of people don't know that. I think that with a lot of family members of mine, in the beginning, what I didn't do was I didn't necessarily address their concerns like I should have. There was a lot of me kind of giving them all this information and this education, and I didn't spend as much time listening like I should have. So I've learned that I really need to listen to patients, and I really need to understand and address all their concerns. They don't have healthcare professionals who they can talk to about cannabis. So that's why I feel like what we do is really important, because we will listen to patients. I wish there are a few family members I would have listened to a bit more instead of just tried to help, because that is so often what I do, especially as a nurse. I just want to help people, and I want to have a tendency to want to fix people. And, when you're trying to educate and support someone, you're really not trying to fix them. You're trying to help them help themselves. So I think those are some good tips. Um, put a comment if there's something I missed. Education, patience. Sometimes it takes several conversations. Another really important thing is if you're providing them information. Some people want pamphlets, which you can print off. Of course, they're all over online. Some people want to go to websites. Don't refer them to really pro cannabis sites, because you really want them to see the education and the information from an organization that isn't promoting something. So there's a couple websites out there that have some really good information, but it's probably not the websites that I would print things off for my grandmother for, or for someone who is, very hesitant about getting started. So I know this was a really long video. I hope the information helped. If you subscribe to our channel, we'll get more viewers, which means we'll get more exposure, and we'll be able to help more patients. Nurse at cannabiscareteam.com if you want to reach out. 888-810-WELL if you want to give us a call. Bye-bye.